What's the one thing you can do to decrease the chance that your breast cancer comes back? I'm Dr. Amani Jambakar. I'm a fellowship-trained breast surgical oncologist, and I get this question all the time from my patients. This is a meta-analysis, or a compilation of many different studies, which was published in 2025, looking at the effects of recreational aerobic exercise among breast cancer survivors. It showed that less than half of the roughly 50,000 patients included in the studies got enough exercise, which is about 2.5 hours per week of moderate intensity activity. When they split breast cancer survivors into 3 groups, looking at those who did either no or minimal exercise, those who did some exercise but still less than 2.5 hours a week, and those who did more than 2.5 hours a week, they then looked at what we call the all-cause mortality rates for each of those 3 groups. And that means that what was the risk that those patients died in the next 5 years, not just necessarily from their breast cancer recurrence, but from any other cause as well, like cardiovascular disease, for example. The 5-year all-cause mortality rate for patients who didn't exercise at all were 11%, compared to 3% for those who did exercise at least 2.5 hours a week. So if you are someone who's going through breast cancer right now, the healthiest thing that you can do to keep the cancer from coming back is to exercise.